You're listening to the Sex and Psychology Podcast, the sex ed you never got in school and won't get anywhere else. I am your host, Dr. Justin Lehmiller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. How does ADHD affect women in the bedroom? That's what we're going to be talking about on today's show. It turns out that it's a surprisingly under-researched topic, and part of the reason for this is because early research on ADHD focused mostly on adolescent boys and children. ADHD in women is under-recognized and often not diagnosed until adulthood. However, emerging research suggests that it has significant implications for women's sexual and romantic relationships, so we're going to dive into what the data say. We'll talk about some of the most common issues that come up in the bedroom for women with ADHD, why different women experience quite different effects, the problem with just relying on medication to help, as well as what women with ADHD and their partners need to know about cultivating supportive environments that are more conducive to sexual pleasure and satisfaction. I am joined by Dr. Leanne Borman, a licensed clinical social worker, ASEX certified sex therapist, professor, and clinical sexology researcher. She specializes in the intersection of ADHD, relationships, and sexuality, and is known for helping clients set their relationships and sex lives up for success in ways that work with their brains, not against them. She runs the podcast ADHD Realities and is currently writing a book on ADHD and low sexual desire. This is going to be another fascinating episode. Stick around and we're going to jump in right after the break. Have you ever felt overwhelmed, exhausted, distant, or disconnected from your partner? If so, you're not alone. But I have a solution for you. It's called Paired. It's an app for couples who want to strengthen their relationships. Paired was founded on the simple belief that real, lasting love is a daily practice. All of Paired's content is backed by experts and relationship therapists, and it really works. You and your partner simply download the app, pair together, and every day, Paired gives you personalized questions, quizzes, and games to stay connected and have deeper conversations. You'll learn how to communicate better, open up more, and argue less. One of my favorite things on the app are the quizzes, including the yes, no, maybe sex list. It's a fun exercise that you can do to figure out the areas where you and your partner overlap and get some inspiration for new things that you might try together. This was one of the first quizzes that my partner and I completed on the app, and let's just say that it definitely gave us some new ideas. Whether you're just a few dates in or have been together a long time, find the time to connect with your partner and nourish your relationship. Start strengthening your relationship in an easy and fun way, and it only takes 5 minutes a day. Head to paired.com/Justin to get a 7-day free trial and 25% off if you sign up for a subscription. Just head to paired.com/Justin to sign up today. Are you looking for a space that celebrates diverse perspectives, explores new frontiers, and brings all of your favorite people together? The annual Sexological Conference, hosted by Sexual Health Alliance, is where sexuality leaders gather. This conference connects you with world-class experts, leading sexuality companies, and a community of like-minded, passionate, and welcoming professionals. You'll find your people at the Sexual Health Alliance annual Sexological Conference this October. Get your ticket to be inspired, educated, and empowered. Note that this conference is open to anyone and everyone. Head over to sexualhealthalliance.com, select the annual Sexological Conference page, and save your spot today. Hi, Leanne, and welcome to the show.
Thank you so much. I'm so happy to be here.
Well, thanks so much for joining me. So let's talk about ADHD in women and how it affects their intimate lives. So as a starting point, please tell us what we know about how common ADHD is in women. So how prevalent is this form of neurodivergence?
So to give you the gist, we have a lot of research on childhood experiences. And when it comes to adult experiences, we're lacking. So to give you like the stats or the commonalities, if you will, is kind of hard because even the research is still trying to pick up from that place. But what we do know is just when we're looking at girls, specifically in childhood, studies are averaging around like 3 to 4% in terms of diagnosis and knowing that they have. And when we look at boys, obviously, the number is a lot higher. And recently, research has started to care to look into the adult experience. And we are seeing a lot more women being diagnosed later in the game. And we see in the research, it says it's really more about like the social stigma or stereotypes of what ADHD is supposed to look like, right? It's like the boy bouncing off the wall. And there's so many different experiences that are true to an individual with ADHD. And so women in general are just missing the mark in childhood. So when we're talking about how common it is, clinically speaking, common. We see it in the research now. It is common, but we're really struggling to find that number right now because we're still really just opening the door to figure that part out.
Yeah, that's something I've always found interesting about research on ADHD diagnoses is that this is something that has typically historically been thought of as this childhood condition because it's most commonly diagnosed among young boys. But for women, increasingly, as you said, we're seeing it being diagnosed in adulthood rather than childhood. And so, that creates some gap in the literature in terms of our knowledge about how ADHD affects women. And I think you're right that there are a lot of different reasons for why ADHD might be diagnosed more in boys than it is in girls. And I think in some cases it's often overdiagnosed in boys, right? Because I think oftentimes people will see, boys who are bouncing off the walls and immediately assume that it's ADHD when in fact that might just be a typical way that, young boys kind of are. So it's a complicated thing where I think in terms of some of the research, we're seeing overdiagnoses and maybe higher prevalence than it actually is, but in other work, especially on women, underdiagnosis. So it's definitely a tricky research area.
Yeah, for sure. And I'll even piggyback off of that. When we are talking about overdiagnosis in childhood, not for nothing, most of the time people are flagging when you're being, quote, disruptive to the norm of how you're supposed to be showing up in these dynamics. And unfortunately, when it comes to recognition, a lot of social norms placed on women just in general and girls is to be, passive, just be relaxed. You're not allowed to show your emotions like that. And that's not typical. And then there's so much nuance to it. But the overdiagnosis, I do professionally believe stems from a lot of practitioners, providers not staying in their lane and not understanding the nuances, right? You have the hormonal part. Specifically, I'm talking about like perimenopause and menopause that can kind of play a role in that. We have research that shows menstrual cycle and the symptoms that we have can mimic ADHD symptoms. And so if you're not really aware of all those layers, yeah, we can overdiagnose and possibly be diagnosing things that aren't actually true to the individual's experience.
Yeah. And I think, the other big problem with so much of the research on ADHD is that it's so focused on childhood. And I think there's kind of been this longstanding assumption that people kind of, quote unquote, grow out of ADHD, right? And that's not the reality. And so we need more research attention on how ADHD affects adults, including how it affects their intimate relationships. So I appreciate the work that you're doing in this area. We've had a few guests on the show previously who have discussed ADHD and sex, and those episodes tend to be pretty popular because there are a heck of a lot of people out there who have ADHD or they're partnered with somebody who has ADHD and want tips in terms of, how do you navigate relationships when one or even both partners have ADHD?
100%. Yeah, definitely.
So ADHD and sexuality is still an understudied topic, but as I said, there's a growing amount of research looking at how ADHD manifests in intimate relationships. But a lot of that work has focused specifically on men, or it's looked at women who are partnered with men who have ADHD, which we've talked about in some previous episodes. So let's talk about how ADHD affects women. So based on your clinical experience, what are some of the most common issues that come up for women with ADHD in terms of how it affects their sexual and or romantic relationships?
Yeah, so that is a great and loaded question. And I think what I'm going to do is I'm going to start with expectations. I think that's a really great place to start to unpack what we see or what I see in my practice versus also even what is being seen in the research. So when you think of sex, sex is designed neurotypically. And what I mean by that is there are neurotypical expectations that are placed in sex. And I'm going to explain it because this is really important. My work that I do is really centered on setting our environments up for our success. And that obviously includes not just work, but it includes your relationship, it includes your sex. And so when you think of sex, good sex, right? Well, good sex, it assumes that the brain is going to be able to focus. It's going to be able to regulate their emotions, manage any type of sensory input, output, and be able to stay in the moment. Those are 4 areas we ADHDers struggle with immensely, depending on the individual, because ADHD also is experienced on a spectrum. And I think that's really important to say because anything I say or you read may not be your story. And that doesn't mean your ADHD is less than or that maybe you're worse than the other person. It just means that your experience is your own, really, when you think about it. So when it comes to the typical experiences, we're seeing the exact same thing that we see in the literature, struggling with orgasm, struggling to show up, right? Like, I think that's one of the biggest complaints and conflicts I work with many of the women. It's like, I'm horny, I like my husband, I love my partner, but like it's just a real struggle. There's also the ability to stay regulated, stay in the moment, checking out. And at the end of the day, all of those things don't necessarily have to be negative. But when we look at the expectations, they automatically become negative, right? Like, no, you're supposed to stay focused. You're not supposed to think about the emails you didn't send out 3 days ago and then have to maybe communicate with your partner and say, hey, listen, I just zoned out. Can we like regroup here a little bit? Like that isn't, quote, typical. So it becomes very distressing for a lot of individuals. And the research itself is really big on pathologizing ADHD, especially around the sexuality piece. And it's always really focusing in on telling us like where we're kind of sucking in, if you will. Like, right, we're struggling with our desire. We're struggling with the orgasms. We're struggling to stay attentive, but no one has like really taken the extra step and been like, but why? Is it really ADHD? Right? Like that is at the core. And so to answer your question in full, I would say orgasm discrepancies, the desire piece, trying to show up and actually be there, and then being pulled out of it in the moment. And specifically, the sensory piece is kind of what meshes in with all of that.
I appreciate what you said there. And I think you're right that our expectations for sex are pretty neurotypical, but also a lot of the sex advice that we give kind of assumes that people are neurotypical as well, right? Because a lot of it is about, you just need to get out of your head and into the moment. And we need to reduce distractions and stop thinking about work and those emails and the dishes that need to be done and so forth. And that's easier said than done for some people, right? So, maybe the sex advice that we give needs to be tailored a little bit more to the specific circumstances or context of the individuals involved.
Yeah. And to even piggyback off of that, it's where like I kind of like hold like a wave in our community because I'm always big on we need to be doing better to teach sex therapists, anyone that's working with anyone, this lens because it's an important lens. Like when you even just break down sexuality, it's who we are, right? And so when you really think about it, as of right now, even though I know there are really great people out there always wanting to learn, always wanting to support, as a whole, I do side with we're still far from neurodiverse in the interventions and how we're providing education to our providers, our medical providers, anybody that's going to be working with somebody who is neurodivergent.
Yeah, totally. And it goes back to the gaps in the research. I think the idea that ADHD has historically been viewed as a childhood disorder, right, means that we just don't have the research out there on how it affects adults and their intimate relationships. And that's part of the reason why a lot of therapists aren't informed on this particular subject. And when you start thinking about other forms of neurodiversity like autism and so forth, again, that's also been considered a taboo topic to even study, right? So again, we just don't always have the research to be able to create evidence-based interventions that therapists and counselors and other mental health providers can use. So it's definitely an area where we need more work. But based on my reading of the research, It seems difficult to say that ADHD has just one singular effect on sexual function. I mean, some studies find that ADHD is linked to orgasming prematurely, whereas other studies find that it's linked to delayed orgasm or no orgasm at all. And the same goes for sexual desire. Some findings point to ADHD as being linked to hypersexuality, and others link it to hyposexuality. So in other words, the link between ADHD and sexual function is pretty complex.
And I think this is where my dysregulation comes in on this topic is while we see such differences in the literature, when you really unpack and dissect the literature, again, they're setting their studies up to not really investigate the environment. So we're just focusing on ADHD. And so it creates almost this lens as ADHD is the cause when I got to be honest, in reality, there's a lot more environmental reasons that we see in practice being the real crux of where the disconnect comes from. And even the topic of hypersexuality, tons of people talk about ADHD hypersexuality, and actually the literature talks about hypersexuality being more common in individuals with neurodevelopmental disorders. So even things like Parkinson's disease, Alzheimer's even, it's not just ADHD. And again, many of these studies aren't necessarily breaking down what hypersexuality really is. Where are your belief systems attached to it? Is it just like you have a higher sex drive than your partner? Or is this really impacting your day-to-day functioning? So when we are looking at research, this is where it's hard to trust the research because while there's good intentions and we're trying to really better understand everything, the setup and the design itself is still lacking dramatically for us to really be able to pull apart, is it really ADHD? Or are there other things going on here? I hope that answered your question.
Oh, yeah, definitely. And, to add another further layer of complexity to this, there's also that question of, is this ADHD or is this, insert whatever disorder it is that we're talking about here, or is this a product of medication that somebody might be taking? And, I've been reading some work recently on Parkinson's disease and how some of the dopamine agonist drugs that are used for this are linked to hypersexuality. And some people who are taking these drugs find that they're suddenly flooded with sexual desire and engage in behaviors that they previously never would have engaged in sexually. And sometimes this even ventures into very risky types of behaviors that, again, they wouldn't have previously engaged in. And for them, that might be a product of medication that they're taking. And so, that adds a further layer of complexity. And then when you also factor in that ADHD itself isn't just one thing. There's an inattentive type, there's an impulsive type, and there's a combined type. It just makes it very difficult to say hey, there's one singular effect and it's due to this, because it's just a very big, very complex topic of conversation.
And I'll even add to that. And by the way, I love that you're a research nerd. So to have this conversation is so awesome. The further problem with that also is that we know that presentations, so quote, those types can actually vary across one's lifespan. So when someone's getting a proper diagnosis, they could be considered more hyperactive in their presentation during their diagnosis. But in 5 years or every single time they get their menstrual cycle, they can be inattentive. And again, that's where these designs in terms of research aren't also putting that into the picture to better understand. So this is another reason you're going to constantly see differences in the stats because we're not being mindful or creating space to document those as well in terms of the variables.
Yeah, and it's why you might see inconsistencies across studies and so forth, and it makes it harder to make sense and put together, what is actually going on in the literature.
100%.
Hey, lover, when was the last time you had a truly memorable date night? I'm not talking about one where you just saw a really great movie or show, or where you had a truly delicious meal at a fancy restaurant, but one that actually made you feel connected, excited, and maybe even a little adventurous. If your date nights are starting to feel predictable, or they're still fun, but you're just not really connecting in the way that you want, it's time to shake things up with Beducated. Beducated is your go-to resource for turning a typical or average evening into a mind-blowing experience. With Beducated, you get access to over 100 expert-led courses designed to help you and your partner explore new sensations, build deeper intimacy, and have way more fun in the bedroom. Not sure where to start? Try something playful like the Experiments for Couples course, or melt in each other's hands with tantric date nights, or the sensual yoni and lingam massage tutorials. Or if roleplay's your thing, there's even a daddy roleplay guide to help you explore your fantasies in a safe and sexy way. There are courses for everyone and every flavor. Beducated makes it easy to learn at your own pace from anywhere. So don't settle for the same old routine. Make your next date night unforgettable. Beducated is where toe-curling pleasure meets expert-backed education. Get 50% off the yearly pass by using my last name, Laymiller, as the coupon code. Try Beducated risk-free with a 14-day money-back guarantee. Check the show notes for the link and be sure to use my last name to get your discount. So you're working on a book right now in which you dive into the topic of ADHD and sexual desire. And as we mentioned, low desire is something that many people with ADHD report, but you have kind of a novel theory on this, which you alluded to a little bit earlier. And you say that we need to rethink how we define low desire in the ADHD brain. And you say that the desire is usually there, but the person is frozen due to what you call executive dysfunction. So what do you mean by that? What is executive dysfunction, and how does this contribute to low desire for somebody with ADHD?
Yeah. First and foremost, I didn't come up with the term executive dysfunction. That is the term that we use in our field. It's the medical terminology to just basically say an individual who is not operating at the level that is, quote, expected in terms of executive functioning when we're looking at the standards of day-to-day living, right? So I tend to also say like executive functioning barriers because that's kind of what I believe they are. Because again, I don't professionally and personally believe that ADHD is necessarily this thing that has to restrict us, especially if we're placing focus on the environment. Now, that's not to say just because we put effort and work into trying to set our environments up that all environments are going to be warm and welcoming. Right. We're still going to struggle with access. And so when we talk about low desire, one of the things that I started realizing, not just in the work I've been doing in the last 7 years with my clients, but also my personal life, is that low desire wasn't the full picture of what was going on, right? Like you learn about spontaneous desire, you learn about even responsive desire to make sense of your experiences. And then low desire is just the avoidance completely. Like you don't even have the fantasy anymore. You're not interested. Like you are so disconnected. Dr. Lori Brotto and her, I can't remember the book name. Oh no. Her most recent.
Better Sex Through Mindfulness.
Yes, thank you. Oh, I love it. She talks about how low desire, there's something that provokes it. Right? So a stressor, whether that's medication, something in the relational dynamic, and then because now we have anxiety, it kind of exacerbates it. And so it becomes a vicious cycle. But when we look at executive functioning, especially when we're looking at our barriers, that puppy isn't just a stressor that gets provoked. That is never ending. If we have deficits to our executive function, right? To be present, to be able to jump from thing to thing and just be able to get into the zone, we're always going to struggle. And so what I talk about as I'm writing this book is that for a lot of us, women with ADHD, it's not about desire being gone. It's about executive functioning kind of being the gatekeeper to us gaining access to our desire. And that's not to say that women also don't then experience low desire. I'm not denying that because that is going to be a possible outcome. But when we really are trying to focus on executive functioning and the barriers, especially when going back to like sex has neurotypical expectations, and you're not trying to show up in a way that's working with your brain, you're going to pause. You're not going to be able to show up with excitement. You may be horny, but you're still going to struggle. I hope that made sense.
Yeah, it definitely makes sense. So yeah, I mean, it could be an issue of maybe this is truly low desire, or maybe desire is there, but there's this executive dysfunction, and we need to learn how desire works in our bodies so that we can show up in the way that's going to allow us to experience that desire and to experience sexual pleasure.
Yeah.
So as a clinician who is working with clients who have ADHD and low desire, how do you address that? How do you work with clients to change the way that they approach sex so that it feels safe to them and works for them?
Well, first and foremost, I am not a provider that diagnoses ADHD. I like to stay in my lane. But what I like to do is I like to map out executive functioning. So I'll ask a variety of questions just to better understand where the person might feel they're struggling. So that will looking at work. It would look at, home styles. And then we go into like sensory experiences. Most people who start working with me, they've never actually thought about any of this. They're being asked questions for the first time that they're like, huh? And so even having to reflect on those can be hard. So I map out executive functioning, arousal, how that looks in the person, their nervous system, etc. And then I get into the nitty-gritty of better understanding what are your expectations, right? What do you believe your role or your script is as a woman showing up to sex with your partner? Where do you start seeing some struggles for yourself? I really like to use my strength as an ADHDer and my curiosity and really dig in and better understand like what's going on for you. So a good example, I like visuals. I was recently working with a client for the last 6 months who just finally discharged. And when they came to me, they said the same thing I usually hear all the time. Like, I love my husband. I want to have sex. I'm masturbating. Like, I'm able to masturbate, but I'm struggling to show up. And we started to break down where for her the disconnect was. And it was more because sex is a task. People don't really like hearing that because it takes the sexy out of sex, I guess, but it is a task. And so her husband would come home and they didn't have kids, so it was kind of a little bit more free and fluid with their abilities, but he would come home, they would both be coming home from work, he would be in the mood and he'd be like, okay, I'm ready to go. That wasn't working for her because of task switching. And task switching is a common conflict for a lot of us ADHDers. And it's the ability for us basically to go from one mental process to the next with really no difficulty. For us, like we need a bridge. Like we can't just jump. And so that in itself can be very overwhelming. A lot of women also, we talk about the sensory experiences. So the afterwards cleanup is a popular one as well. The individual who knows that they are going to need to be showered or clean, the idea of taking a shower after having sex at the end of your day can literally be so exhausting because it's task paralysis. Just think about taking a shower. If you have bottles with caps, you have to take off each of those caps. You have to lather your body. Like, I know this sounds weird to say it out loud, but that is a lot. And for executive functioning deficits, like, we may not have that in our tank to do. And so it's just as simple as, okay, can you renegotiate? Can we touch today that there's no fluids involved? And people like are blown mind-wise of like, wait, we can do things that isn't like A to Z. Like we can have like an a la carte service here with sex. I'm like, yeah, you can. That's kind of how I mean, your question is hard to answer in full only because there's so many different stories. There's so many different approaches. And again, ADHD is on a spectrum. But for me, I really like to map out what is your experience? How does executive function play in it? And then start getting curious on how do we like set things up that's working with your brain, not against it.
Yeah, I think a lot of people can probably relate to what you just said, whether they have ADHD or not. And it goes back to these neurotypical beliefs about sex. One of them being the idea that sex is, quote unquote, supposed to be spontaneous, right? And it's just kind of this thing that just naturally, organically happens in the moment. And, this is at the root of a lot of desire discrepancies in relationships, is that one partner is horny and in the mood, and the other partner just isn't in the right mental place to be able to sexually engage. And I think oftentimes it is due to that, task switching of like, oh, like sex entails not just having sex, but all of these other things that go along with it. Like maybe you want your body to be physically prepared before you have sex. And so that means, you need to do some work or put some effort in before you have sex, and then have sex itself. And then there's the cleanup and other things that happen afterwards. And so sex isn't just sex, it's all of these other things that are attached to it. And so in some ways it can kind kind of become this overwhelming thing where there's just all of these other things that need to happen. And maybe your partner doesn't quite understand that or what your thought process is behind all of this. And they interpret your no as, well, you're rejecting me, you're not attracted to me, you don't like the sex that we're having. And it's like, no, it has nothing to do with that, right? It's really just, I need to be in the right place mentally in order to have sex. And I think that's at the root of a lot of issues in relationships where one partner has ADHD and the other doesn't, is that they just don't really get each other, if you will, in terms of what their needs are when it comes to sex.
Yeah, and I'll add another layer to that. And I think you bring up a good point because most of the individuals that I'm working with don't even know that that's what's going on for them.
Yep.
So they do internalize and they do then believe that maybe I'm not interested in sex. Maybe I'm asexual. Like, I can't tell you how many times people have said that, right? Or there's something wrong with me or my relationship is doomed. Maybe I'm just in a wrong relationship. And so I tend to see more people who don't even know that narrative that you just outlined so beautifully. And we're learning that through the work I do with my clients. So they do have a voice, which is really vital to then being able to do any type of setup for yourself.
Yeah. Now, a lot of the advice that you'll hear out there about ADHD and sexual difficulties focuses primarily on medication. And, I think this is true more broadly of treating sexual problems because there's been this growing medicalization of sex. We often look to drugs as kind of our frontline treatment. And while medication can certainly help, and I'm all for having more tools in the arsenal, I'm not anti-medication, I think we need to do more than say, okay, here's your prescription, good luck, We also need to do a lot of work on the cognitive behavioral side if we want lasting change and bigger effects, right?
Yeah, 100%. And I think this is where, I have a love-hate relationship with medication, not because I think that it doesn't work, but we do know that medication is specifically, like when we're talking about stimulants, it doesn't actually work for everybody.
Yep.
And when we're looking at medication, a lot of people, even therapists and providers still, they think that that's going to be what allows organization skills all of a sudden. It's going to be what allows you to be able to show up and be, quote, typical. And that's actually not what the medication does. You're talking about those are skills, right? Medication is just supposed to help you regulate in a way that your brain is struggling to regulate without it. And that doesn't necessarily mean it's going to allow you to show up in this now typical way. For instance, I take Adderall. Now, Adderall for me actually helps with my overstimulation. So if I'm not taking my Adderall, I am quicker to become overstimulated than when I'm on it. And that's because it's targeting the parts in my brain that I naturally have deficits in. And so without feeling overstimulated, I'm able to now be more attentive versus without it. So my stimulant reaction isn't necessarily the stimulant is going like, okay, you're good to go, boom, 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 boom. It's just allowing me to not feel so overstimulated to then allow me to show up in a way that I struggle without it, if that makes sense.
Yeah, totally makes sense. It'd be nice if we could just take pills that,
I love that.
did everything that we wanted to have it do magically. And, we didn't have to do any other work. But I think the research is pretty clear, especially when it comes to treating things like sexual problems, is that cognitive behavioral therapies oftentimes are more effective than pharmacological therapies, in part because they're teaching you lifelong skills, right? And, when you're taking a drug or medication, you're only going to get the effects as long as you're taking that drug or medication, right? And so oftentimes we have better success with combining pharmacological with the cognitive behavioral approaches. But unfortunately, oftentimes people just get the medication because it's easier for the provider to just prescribe that. And it's often cheaper for the patient to just take the drug as opposed to doing the hard work of being in therapy for a long time. So it's partially about oftentimes the provider and the patient want the quick fix, but the quick fix isn't necessarily going to be the thing that provides the lasting change that you're really looking for.
Yeah. And I think also it's really important to note, and a lot of people don't recognize this, is that cognitive behavioral therapy is a wonderful tool, and I don't bash it at all. But what I do bash is that a lot of therapists are providing it with neurotypical expectations without understanding executive functioning barriers. So for instance, cognitive behavioral therapy in real time while you're in a therapy session is freaking magical because you have the therapist literally being your executive function by challenging, remembering, being able to process in a way. So when therapists are trying to use cognitive behavioral therapy outside with the activity worksheet, or the next time you feel this way, go grab the document or the form and go write, yeah, I'm sorry, us ADHDers are not going to do that. And they actually did a study 2 years ago. I can't remember the year. It was a very, very small study done in a different country. And it actually asked about 10 participants whether they believed CBT was more helpful or harmful. And only one of the 10 participants said it was helpful. Everyone else who had ADHD said it was harmful. And the difference between that one individual versus those other 9 is that therapist was neurodivergent friendly. And so we see it all the time. Cognitive behavioral therapy can be wonderful if it is provided in a way that's neurodivergent friendly. And Dr. Russell Barkley talks about this as well, about how mental health interventions can actually cause more psychological negative effects than benefits when we're talking about ADHD severities. And so when we go back to this medication versus CBT model and therapy, this is why therapy really has to be neurodiverse, because if we're showing up to therapy and we're being told, well, this is what you should be doing and this is how you should be doing it, and we still are failing, we feel like a crap, like total crap. We're failing, we're shame spiraling, no different than our childhoods for so many of us.
Yeah, very well said. Well, thanks so much for sharing all of this, Leanne. I'm really looking forward to continuing our conversation in the next episode, where we'll be diving into the subject of ADHD and kink. Can you please tell my listeners where they can go to learn more about you and your work?
Yes, definitely. So first, thank you so much for having me. It's been a wonderful time jamming out and nerding out with you. In regards to social media, I'm on Instagram and TikTok. I'm more heavily on Instagram than TikTok. I can't task switch between the two. It's at Borneman Psychotherapy. I have a website, www.bornemancoaching.com. You can get all the information, not just on my research, but if you're interested in working with me. I also provide free resources and some courses on there specifically centered towards our experiences as ADHDers and our sexuality.
Well, great. And we'll be sure to include links to all of that in the show notes. Thank you again so much for your time. I really appreciate having you here.
Thank you.
Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. If you listen on Apple Podcasts, please consider becoming a Sex and Psychology Premium subscriber to enjoy ad-free listening for just $3.99 a month. You can also follow me on social media for daily sex research updates. I'm on Blue Sky and X at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. Thanks again for listening. Until next time.